Assalamualaikum warahmatullahi wabarakatuh. Shalom, Om Swastiastu, Namo Buddhaya, Salam Kebajikan. Hello everyone, we are psychology students from 11 Maret University, Group C from Class C, that consists of myself, Lampita, and then my friends are Mahira, Hafizal, Zakwan, Najma, and Naura will present to you a topic about mental health issues as a fulfillment of an assignment for our English for Psychology course. Okay. In many ways, mental health is like physical health. Everyone has it and we need to take care of it. Good mental health means generally being able to think, feel, and react the way you need and want to live your life. But if you are going through periods of poor mental health, you may find the way you often think, feel, or react to be difficult or even impossible to cope with. It can feel as bad as physical illness or even worse. However, in reality, health problems are common in humans. They can happen to all kinds of people from all walks of life. Having a mental health problems is often upsetting, confusing, and scary, especially at first. If you become unwell, you may feel that it is a sign of weakness or that you are losing your mind. Have you ever been in such a bad situation as if you wanted to explode and wanted to ruin everything around you? Or maybe, have you ever felt excessively anxious every time you are faced with some object, like a ghost or darkness, for example? If you are, then you are very lucky, because in this video, we from Group C will explain to you a topic related to this case, that is about anger and phobias. Anger and phobias are a form of emotional situation that is common and we often encounter in our daily environment. Anger and phobias may be two different emotional cases, but did you know that they themselves can be categorized as a form of mental disorder that we must pay attention to, because if we don't prevent it further, it can get worse. Actually, there are several similarities and differences of anger and phobias that can be divided into its causes, symptoms, treatments, and disorders. And in this video, we will discuss such things. First, we will discuss about anger starting from the definition, causes, symptoms, and treatments. After that, the second point that we will discuss is about phobias, which consists of definition, types, causes, symptoms, and treatments. And then, in the last discussion, we will discuss about the similarities and differences between anger and phobias that are revealed through their causes, symptoms, treatments, and disorders. So, the first that we will discuss about is anger. Anger, as we know, is such a normal, healthy emotion which we might experience if we feel attacked, deceived, frustrated, invalidated, or unfairly treated. But anger could also be a problem when it gets out of control and harms you or people around you. This can happen when you regularly express your anger through unhelpful or destructive behavior, having a negative impact on your overall mental and physical health, and it becomes your go-to emotion, blocking out your ability to feel other emotions, and you haven't developed healthy ways to express your anger. As example, in the picture below, we can see that when someone feels anger, they stated that it feels like there's a ball on fire in the middle of my chest that blurts its way straight out of my mouth and burns the people around me. So regarding that, what is unhelpful angry behavior? Angry behavior can be categorized as an unhelpful one when 1. Outward aggression and violence. It happens when someone is doing something such as shouting, swearing, slamming doors, hitting or throwing things, and being physically violent or verbally abusive and threatening towards others when angry. And the second one is inward aggression. It happens when someone is doing something such as telling yourself that you hate yourself, denying yourself your basic needs like food or things that might make you happy, or cutting yourself off from the world and self-harming. And the third one is non-violent or passive aggression. This happens when someone is doing something such as ignoring people or refusing to speak to them, refusing to do tasks, or deliberately doing things poorly, late or at the last possible minute and being sarcastic or sulky when not saying anything explicitly aggressive or angry. And then after this, the causes, symptoms, and treatments for anger will be explained by my friend Hafizal.
Okay, thank you, Lampita. And I will tell you about causes of anger. Feelings of anger arise due to how we interpret and react to certain situations. Everyone has their own triggers for what makes them angry, but some common ones include situations in which we feel like threatened or attacked, frustrated or powerless, like we're being invalidated or treated unfairly, like people are not respecting our feelings or position. How you interpret and react to a situation can depend on lots of factors in your life, including your childhood and upbringing, past experience, current circumstances. The next part, I'll explain about anger symptoms. Anger feels different for everyone. You might experience some of the things listed below, and you might also have other experience or difficulties that aren't listed here. First, churning feeling in your stomach, tightness in your chest, an increase and rapid heartbeat. You are easily irritated. Red mist comes down on you, feeling humiliated, and etc. Recognizing these signs give you the chance to think about how you want to react to a situation before doing anything. This can be difficult in the heat of the moment, but the earlier you notice how you're feeling, the easier it can be to choose how to express and manage your anger. The next part is treatment and support for anger. There are various treatments available that can help you with anger problems. This page covers talking therapy and counseling, anger management programs, and help for abusive and violent behavior. There are different types of talking therapies, and some are specifically tailored to anger issues, like counseling, psychotherapy, and cognitive behavioral therapy or CBT. Okay, that's all from me. I will give it back to Lampit.
Okay, thank you, Hafizal, for your explanation. Now we are going to the second topic that we will discuss is about phobias. Phobias is a type of anxiety disorder. It is an extreme form of fear or anxiety triggered by a particular situation, such as going outside or an object such as spiders, even when it's very unlikely to be dangerous. You may even feel this extremely anxiety when you think or talk about the situation or object. A fear becomes a phobia if the fear is out of proportion to the danger. It lasts for more than 6 months or has a significant impact on you or on how you live your day-to-day life. As the example in this picture, we can see that when someone occurs phobia of going outside, they stated that going out of the house is a challenging one because they have fear of panicking and feel that being watched or judged. Well, in common, there are two types of phobias. The first one is specific phobias, and the second is the complex phobias. Specific phobias are phobias about a specific object or situation, such as spiders or flying. They often develop in childhood or adolescence. For some people, they might become less severe as they get older. Then specific phobias are divided into several categories. They are 1. Animal phobias, such as dogs, insects, snakes, or rodents. And then the second one is phobias of the natural environment, such as heights, water, darkness, storms, or germs. And the third one is situational phobias, such as flying, going to the dentist, tunnels, small spaces, or escalators. And the fourth one is body-based phobias, such as blood, vomit, injections, choking, medical procedures, or childbirth. The fifth one is sexual phobias, such as sexual acts or fear of nudity. And the last one is other phobias, such as certain foods, objects, or costume characters. And then the second one is complex phobias. Complex phobias tend to have more disruptive or overwhelming impact on your life than specific phobias. They tend to develop when you are an adult. For complex phobias itself is divided into two types. The first one is social phobia. Social phobia is a feeling, a sense of intense fear in social situations that you will often try to avoid them. You might worry about a social event before, during, and after it has happened because of fear that others will judge you negatively. You may also worry about others noticing that you are anxious. And the last one is agoraphobia. Agoraphobia is a feeling anxious about being in places or situations that could be difficult to get out of, embarrassing to get out of, and where you might not be able to help if you have a panicking attack. And then the next one will be explained by my friend Mahira.
Okay, thank you, Lampita. I will explain about causes of phobias. There doesn't seem to be one particular causes of phobias. There are various factors that might contribute to developing a phobia, but there is not often a clear reason why it starts. Okay, the next is symptoms phobia. There are two symptoms of phobia. First is physical symptoms of phobia. Like feeling unsteady, dizzy, lightheaded or faint, feeling like you are choking, a pounding heart, palpitation or accelerated heart rate, chest pain or thickness in the chest, sweaty, hot or cold flushes, soreness of breath or smoothing sensation, numbness or tickling sensation, trembling or shaking. And second, psychological symptoms of phobias. It's like a fear of fainting, a fear of losing control, a fear of dying, a feeling out of touch with reality, or detect from your body, known as dissociation. And the next part is treatment for phobias. One is talking treatments, two meditation, and three self-help advice and information. This includes self-help like books or online programmers or support groups or relaxation techniques. The next part will explain by Najma.
Okay, thank you, Mahira. I will explain about the similarities between anger and phobias. The first similarity that I will discuss is about the symptoms of anger and phobias. In symptom, there are two elements, namely from physical and psychological symptoms. The similarities of physical symptoms are an increase and a rapid heartbeat, chest pain, or tightness in the chest, sweating. If in anger, will sweat profusely in the hands, and shaking or trembling. While the similarity of the psychological symptoms of these two diseases is feel unable to relax, even afraid of losing control. Next, the second element of similarity that I will discuss is about the causes of anger and phobias. The common cause is past incidents or experience. Certain situations might have a lasting effect on your on how you feel about them. Sometimes things that happen in the past can create feelings of anger and or phobias, such as trauma. You may experience excessive feelings when other people feel normal because you may have a bad experience about that. Last but not least, I will discuss about the similarities of treatment of these two diseases. If experiencing anger or phobias, the treatment that can be done is talking therapy. During a talking therapy, you'll talk to professionals such as a counselor or psychotherapist about your thoughts, feelings, or behavior. By doing this treatment, you will find the cause of your anger or phobias and the way to manage it. I think that's all for me. The next term will be Nora, who will discuss the differences between these two diseases. Thank you.
Okay, now onto the difference between phobias and anger. The difference is divided into two. There are differences according physical and psychological symptoms. First, we will discuss about the physical symptoms. The physical symptoms of phobia are categorized feeling unsteady, dizzy, a light-headed or faint, feeling like you are cooking hot or cold foods. And next, anger. You are maybe legs are weak, tense muscles, you feel hot, you have an urge to go to the toilet, or shaking or tremble. That's on the same sort. Psychological symptoms is the people with phobias can occur, such as a fear of fainting or dying, feeling out of touch with reality, or detected from your body, known as dissociations, will the psychological symptoms that can occur by anger suffer, such as feeling tense, nervous, or unable to relax, feeling guilty, humiliated, or resentful towards other people or situations. You are easily irritated are also redness comes down on you. I will explain about the different causes between phobias and anger. Phobias are caused by doesn't seem to be one particular cause phobias. There are various factors that may contribute to developing a phobia. If anger can be caused by many factors in your life, including your childhood and education, past experience, or current state. Okay, third, we will discuss about the treatment differences between phobias and anger. Medication for phobias are in the antidepressants, tranquilizers, and beta blockers. Whereas treatment for anger uses an anger management program consisting of, first, an enhanced anger management course, many trust-free local anger management service. You can ask your doctor what is available near you. Second, the local mind anger management course. Some local talks also provide free anger management or counseling services. Third, contact your local minds directly and ask them what service they provide. Third, online self-help. Several organizations have produced online self-help guides of managing anger. Thank you. Next will be explained with my friends.
Okay, thank you for the opportunity to explain about the summary. So, there are two main points that we are going to talk about. The first is anger and phobias. Next. Okay, there are the importance of anger. Anger is not always bad, as long as we can control the limitation of it. It is also a part of our life and emotion. Meaning of anger itself is a normal, healthy emotion which we might experience if we feel attacked, deceived, frustrated, invalidated, or unfairly treated. There are also three typical types: outward aggression and violence, inward aggression curse, and non-violent or passive aggression. Next. Okay, before I continue to the next of the summary, there are some quotes we want to refer back. Quotes of Dinda, don't be angry. The first one is, my brain goes blank and I absent-mindedly release my anger through physical violence towards myself or objects around me. I don't realize how destructive I've been until immediately afterwards. 2. It feels like there's a ball of fire in the middle of my chest that blurs its way straight out of my mouth and burns the people around me. Luckily, we have two historical hadith that we can use to prevent about anger. The first one, if any one of you got angry, let you be silent. Historical hadith by Ahmad and Bukhari. Also, if you are angry and he is standing, he should sit down because with that anger can disappear. If it hasn't disappeared, he wants to take a sleeping position. Historical hadith by Ahmad. Next. Okay. So there are causes, symptoms, and treatment of anger. Reasons why we are angry. The first one is threatened or attacked, frustrated or powerless, like we are being invalidated or treated as, and like people are not respecting our feelings or possession. This what we are feeling. A churning feeling in your stomach, tightness in your chest, and an increase in rapid heartbeat, and so on. Simple step to treat anger. First, talking to therapy and counseling. Anger management programs help for abusive and violent behavior. Next. The phobias. The meaning of phobias itself. A phobia is a type of anxiety disorder. It is an extreme form of fear of anxiety triggered by a particular situation, such as going outside, or an object, such as spiders. Even when it's very unlikely to be dangerous, you may even feel this extreme anxiety when you think or talk about a situation or object. Next. Types, causes, and symptoms. There are several types. Specific phobias such as animal phobias, phobias of mental environment, and so on. Also, complex phobias such as social phobia and agoraphobia. Last is symptoms. Divided into two symptoms, there are physical and psychological, and the causes of it, various factors causes a phobia. The next will be explained by my friend.
Well, that's all for our presentation about anger and phobias. We hope that you enjoy our presentation, and we also hope that the audience can understand the material well, so that we provide you that all of us can recognize it and avoid the bad effects of anger and phobias, and then overcome them in our daily lives. At last, we say thank you so much for your kind attention.